Most people don't realize that the fat they fear the most is not the one they can see in the mirror. The real danger is hidden deep inside, wrapped around vital organs, silently driving disease long before symptoms appear. Every day I'm asked the same question: Doctor, how many hours should I fast? People want a number, a simple formula. They want to know exactly how long it takes to burn visceral fat. And the reason this question matters so much is because visceral fat is not just extra weight. It is biologically active, it produces inflammatory signals, it disrupts hormones, it surrounds your liver, pancreas, intestines, and kidneys, and it fuels insulin resistance, fatty liver disease, heart disease, cancer, and even dementia. This is not cosmetic fat. This is metabolic poison. Before I go deeper, make sure you are subscribed to my channel, and if this information can help someone you care about, share it with them after you finish watching. The biggest misunderstanding about fasting is believing it works like a calorie calculator. People think that if they stop eating for a certain number of hours, fat simply melts away. That is not how the body operates. The body does not run on calories, it runs on hormones. Until you understand what insulin is doing, you do not truly understand fasting. Every time you eat, especially carbohydrates and processed foods, insulin rises. Insulin's primary job is storage. As long as insulin is elevated, your body is in storage mode. In storage mode, fat cannot be burned, no matter how few calories you consume. If insulin stays high, fat stays locked. Fasting works because it lowers insulin, but insulin does not drop the moment you stop eating. It falls in stages. And those stages depend on what you ate before the fast, how insulin resistant you are, and how often you eat. After a meal, the first fuel your body uses is circulating glucose. Once that is used, it turns to glycogen, which is stored sugar in the liver and muscles. Most people carry about 12 to 24 hours of liver glycogen depending on body size, activity level, and diet. As long as glycogen is available, the body has no urgent reason to burn visceral fat. This is why very short fasts often do little for people who are insulin resistant. If you eat late at night, snack before bed, and begin fasting at bedtime, you may still be burning glycogen well into the next morning. Fat burning has not truly begun. As glycogen depletes, insulin falls further. When insulin drops low enough, a metabolic switch flips. A hormone called hormone-sensitive lipase turns on, and fat cells begin releasing fatty acids. The liver converts some of those fatty acids into ketones, which fuel the brain and heart. This is the moment when visceral fat finally becomes accessible. This does not happen at the same hour for everyone. A metabolically healthy person may enter fat burning within 12 to 16 hours. Someone who is insulin resistant may need 18, 24, or even more hours to reach the same state. That is why the correct fasting duration is not a number you pull from the internet. It is about how long it takes your insulin to fall. Now let's walk through what actually happens at different fasting lengths, because this is where most of the confusion begins. People hear numbers like 12 hours, 16 hours, or 24 hours and assume each is simply a stronger version of the other. That is not true. Each fasting window triggers a different physiological state. At around 12 hours of fasting, most people are still burning glycogen, especially if dinner was late or high in carbohydrates. Insulin may be coming down, but it is not low yet. For metabolically healthy individuals, a 12-hour fast helps prevent further damage, but it rarely burns meaningful visceral fat. It is a maintenance fast, not a reversal fast. At 14 to 16 hours, things begin to shift. Liver glycogen declines, insulin drops more noticeably, and fat-burning hormones like glucagon start to rise. In insulin-sensitive people, this window can initiate fat burning. In insulin-resistant people, it often just completes glycogen clearance. This is why some people feel better at 16 hours, but do not lose visceral fat yet. The body is relearning flexibility, how to move from glucose to fat. That is progress, but it is still early. Visceral fat is stubborn because insulin protects it. If insulin has not fallen far enough, that fat remains locked. When you reach 18 to 24 hours, physiology changes more dramatically. Liver glycogen is largely depleted, insulin falls to very low levels, growth hormone rises to protect muscle, fat cells release fatty acids more freely, and the liver increases ketone production. This is where visceral fat burning becomes meaningful. Many people feel a mental shift here. Hunger quiets, energy stabilizes. This is not willpower, it is chemistry. The brain is now fueled by ketones, which provide a steady, calm energy. Cortisol does not need to spike because the brain is no longer desperate for glucose. Beyond 24 hours, a process called autophagy increases. Autophagy is cellular cleanup. Old proteins, damaged mitochondria, and dysfunctional cells are broken down and recycled. This process is strongly linked to improved insulin sensitivity and reduced inflammation. Visceral fat, which is inflammatory, becomes a target during this phase, but longer is not automatically better. Extended fasts increase benefits, but they also increase stress if done incorrectly. Hydration matters. Electrolytes matter. Medical conditions matter. Fasting is a powerful tool, not a competition. Tell me in the comments how many hours you fast consistently and how it has changed your life. I want to hear your experience. What I want you to understand is this. Short daily fasts train the system. Longer fasts reset the system. Both have a role, depending on your metabolic health. If you're finding this information useful so far, take a moment to subscribe and leave a like, because what comes next is where most people go wrong. The biggest mistake is assuming that what works for one person must work for everyone. People hear that a 16-hour fast helps someone else and immediately try to copy it, expecting identical results. Biology does not work that way. Your response to fasting depends on how insulin resistant you already are. In people who are metabolically healthy, a daily 14 to 16-hour fast can be enough to burn visceral fat slowly over time. Their insulin drops quickly, their liver clears glycogen efficiently, their fat cells respond properly. For them, consistency matters more than duration. A clean daily fast without snacking or sugar can be very effective. But most people today are not metabolically healthy, even if their blood sugar looks normal. They're insulin resistant. And in these people, insulin stays elevated longer. A 16-hour fast may only bring insulin down to the level a healthy person reaches in 10 hours. That means fat burning is delayed and visceral fat remains protected. Human studies consistently show this difference. When researchers examined time-restricted eating in insulin-resistant populations, short fasts modestly improve markers like triglycerides and waist size, but deep fat loss is limited. When the fasting window extends to 18 or 24 hours, visceral fat reduction becomes far more pronounced. The reason is simple. Insulin finally falls below the threshold that locks fat in place. Visceral fat is not passive tissue. It actively responds to hormones. As long as insulin is present, even at moderate levels, that fat stays stored. Once insulin drops low enough, visceral fat releases energy rapidly. Longer fasts also improve insulin sensitivity more powerfully. After a 24-hour fast, the next meal produces a much smaller insulin spike. That means the body does not immediately restore fat. This is why people often notice their waist shrinking even when overall weight loss slows. Visceral fat is being targeted. If you are still listening, type "Yes, doctor" in the comments, so I know how many of you are serious about learning this. Now let's talk about safety, because this matters. Longer fasts are not for everyone. If you are underweight, pregnant, breastfeeding, have a history of eating disorders, or on insulin or certain blood pressure medications, you should not fast without medical supervision. Fasting lowers insulin and blood pressure. That is the goal, but it must be respected. Cortisol is another concern people often raise. Proper fasting does not chronically elevate cortisol. In fact, insulin resistance itself is a cortisol-driven state. Cortisol problems arise from undereating combined with stress, poor sleep, dehydration, and electrolyte imbalance. A well-structured fast with hydration and minerals does not create that environment. The goal is not suffering. The goal is creating metabolic conditions where your body can do what it was designed to do: switch fuels, burn stored fat, and reduce inflammation. So how do you choose? If you are early in your journey, begin with daily fasting, clean it up, remove snacking, remove sugar, let insulin fall naturally. If progress stalls, that is information, not failure. It means your body needs a stronger signal. Now, let me explain how you know fasting is actually working, because many people confuse calorie reduction with metabolic change. Weight loss on the scale does not tell you what fuel your body is using. Visceral fat loss is a hormonal event, not a calorie event. When fasting works correctly, insulin stays low long enough for fat-burning hormones to dominate. Glycogen rises and signals the liver to release stored energy. Growth hormone increases and protects muscle. Proper fasting does not waste muscle, it preserves it. Muscle loss happens when insulin is high and calories are low, not when insulin is low and energy comes from fat. One of the earliest signs that visceral fat is being burned is a change in hunger. Hunger becomes quieter, more predictable, less urgent. That is because your brain is no longer dependent on glucose spikes. Ketones cross the blood-brain barrier easily and provide steady fuel. When the brain is fed, cortisol stays low. Another sign is improvement in waist size before major weight loss. Visceral fat drains directly into the liver. When it shrinks, liver inflammation improves quickly. This often appears as better fasting glucose, lower triglycerides, and improved energy even if the scale barely moves. Hormones coordinate this entire process. Insulin falling removes the brake. Glucagon releases stored fuel. Growth hormone protects muscle. Norepinephrine increases fat mobilization. This environment cannot exist if you are eating every few hours, even if total calories are low. Autophagy is another misunderstood element. It does not switch on at a fixed hour. It rises gradually as insulin falls and nutrient sensing decreases. Longer fasts amplify it, but daily fasting improves cellular cleanup over time. Autophagy removes dysfunctional fat cells and damaged mitochondria, making future fat burning easier. Sleep also improves when fasting is done correctly. Many fear fasting will disrupt sleep, but the opposite is often true after adaptation. Nighttime insulin drops allow growth hormone to rise. This improves repair and metabolic health. Poor sleep is often driven by late eating, not fasting. If this information is helping you, remember to subscribe and like this video. Now let's talk about plateaus. Plateaus are not failure, they are feedback. If a 16-hour fast improved energy but did not shrink your waist, your body is telling you insulin resistance is deeper. That does not mean you immediately fast longer. It means you clean up the eating window, reduce carbohydrates, and stabilize electrolytes. Fasting is not about pushing harder. It is about lowering insulin enough for long enough. Sometimes that requires an occasional 24-hour fast. Sometimes it requires better sleep and stress control. Cortisol and insulin work together. If stress is high, insulin resists falling. This is why sustainability matters. The best fasting window is the one you can repeat calmly without dehydration, anxiety, or obsession. A fast that raises stress defeats its purpose. Your nervous system must feel safe for fat burning to occur. Now, I want to explain how to choose the right fasting window for you. Because copying someone else's routine is one of the fastest ways to fail. The correct fasting window is not about trends, it is about matching your physiology. Age, metabolic health, medications, sleep quality, and stress levels all matter. Ignoring these factors is how people get into trouble. If you are relatively young, not on medications, and only mildly insulin resistant, a daily fasting window of 14 to 18 hours is often enough. The key is consistency. Eating within a defined window each day allows insulin to fall predictably. Over weeks and months, insulin sensitivity improves and visceral fat begins to shrink. The body learns a rhythm. It adapts. Fat burning becomes natural rather than forced. If you are older or clearly insulin resistant, meaning you carry abdominal fat, have fatty liver, elevated triglycerides, or rising fasting glucose, you may need a stronger signal. In these cases, occasional 24-hour fasts can be very effective. 1 or 2 24-hour fasts per week can dramatically lower insulin and accelerate visceral fat loss, even if daily fasting alone has stalled. But frequency matters. Doing long fasts too often without recovery raises stress hormones. The body responds best to rhythmic stress followed by nourishment, feast and fast. That is how human physiology evolved. Medications must always be considered. Anyone taking insulin, sulfonylureas, or certain blood pressure medications must be careful. Fasting lowers blood sugar and blood pressure. Without adjustment, this can cause hypoglycemia or dizziness. These individuals should work with a knowledgeable clinician. If you are still listening, comment yes, so I know how many of you are truly engaged in this lecture. Now, let's be clear about who should not fast. Pregnant women, breastfeeding women, underweight individuals, and people with a history of eating disorders should avoid fasting. Their physiology prioritizes growth, repair, or psychological stability over metabolic flexibility. Fasting is not appropriate in these contexts. Another myth we need to address is that fasting slows metabolism. When fasting is done correctly, the opposite happens. Insulin suppression increases fat availability. Growth hormone preserves muscle. Resting metabolic rate is maintained or even slightly increased. Metabolism slows when calories are restricted chronically while insulin remains high. Hydration and electrolytes are non-negotiable. Sodium, potassium, and magnesium are lost during fasting because insulin normally causes the kidneys to retain salt. When insulin falls, salt is excreted. Replacing electrolytes prevents fatigue, headaches, and muscle cramps. Another common mistake is breaking a fast poorly. Ending a fast with sugar or refined carbohydrates spikes insulin aggressively and can undo much of the benefit. The first meal after fasting should be rich in protein and fiber and low in refined carbohydrates. This keeps insulin controlled and extends fat burning. Fasting is not a moral test, it is a metabolic strategy. If a fasting window increases anxiety, disrupts sleep, or creates obsession, it is not the right tool at that moment. Stress hormones can block fat loss just as effectively as insulin. If this content is helping you, remember to subscribe and leave a like. Let's bring everything together, because fasting only works when applied intelligently and patiently. The mistake most people make is treating fasting as an event instead of a rhythm. The body responds best to patterns it can predict and adapt to. For most people, the foundation should be a daily fasting window. This trains insulin to fall and remain low. Once the body adapts, fat burning becomes easier and hunger becomes calmer. This is metabolic flexibility, the ability to switch between glucose and fat without stress. Layered on top of that foundation, occasional longer fasts can be used strategically. Think of them as metabolic resets, not daily requirements. A 24-hour fast once a week or a few times a month can dramatically accelerate visceral fat loss in insulin-resistant individuals. More is not better. Recovery matters. Progress should be tracked using waist circumference, fasting insulin if available, triglycerides, and how you feel. The scale can mislead. Visceral fat loss often comes before major weight change. Clothes fitting differently is often the first true signal. One of the most powerful but overlooked benefits of fasting is inflammation reduction. Visceral fat releases inflammatory cytokines that affect the liver, blood vessels, and brain. As visceral fat shrinks, markers of inflammation improve. This is why fasting can improve fatty liver, blood pressure, and mental clarity. Sleep is another key factor. Fasting works best when sleep is adequate. Sleep deprivation raises cortisol, which raises insulin. You cannot outfast poor sleep. Prioritizing rest often unlocks fat loss that fasting alone cannot. Exercise complements fasting, but excess can backfire. Resistance training preserves muscle and improves insulin sensitivity. Short bursts of intensity are more effective for visceral fat than long endurance sessions. Chronic cardio combined with fasting can raise stress hormones and slow progress. Finally, fasting should simplify your life, not complicate it. If you are constantly thinking about food, timing, or rules, step back. The goal is freedom from metabolic chaos, not another source of stress. The most successful approach is boring, repeatable, and calm. Eat real food. Stop snacking. Let insulin fall. Use fasting as a tool, not a punishment. Here is the practical framework I want you to carry with you, because clarity matters far more than intensity. The goal is not to fast as long as possible. The goal is to fast long enough for insulin to fall, for fat burning to turn on, and for inflammation to calm down without creating stress in the body. Everything begins with understanding where you are right now. If you have little abdominal fat, normal triglycerides, good energy, and stable blood sugar, a daily 14 or 16-hour fast may be all you ever need. That alone prevents metabolic damage and keeps visceral fat from accumulating. Think of this as metabolic hygiene. It is like brushing your teeth for your metabolism. It keeps problems from forming. If, however, you carry belly fat, have fatty liver, rising fasting, glucose, or a strong family history of diabetes or heart disease, you likely need a deeper intervention. In that case, clean daily fasting becomes your base, and strategic 24-hour fasts become your accelerator. One 24-hour fast every few days or once a week is often enough to push insulin low enough to unlock visceral fat. The body finally receives a signal strong enough to change direction. But this is not about ideology. It is about feedback. If your waist is shrinking, your energy is improving, and your hunger is calmer, you are doing it correctly, even if the scale barely moves. If you feel cold, anxious, exhausted, or obsessed with food, something is off. That usually points to poor sleep, inadequate electrolytes, or too much stress layered on top of fasting. Remember that insulin resistance is the real enemy. Visceral fat is not a calorie problem. It is a hormonal problem. Anything that keeps insulin high, such as frequent eating, refined carbohydrates, poor sleep, and chronic stress, will block fat loss, no matter how disciplined you are. This is why sustainability matters more than willpower. A fasting plan you can follow calmly for years is infinitely better than an aggressive plan you abandon in weeks. Health is not built by extremes, it is built by consistency. Also, remember that fasting is not mandatory. It is a powerful option, not a requirement. Some people restore insulin sensitivity through diet quality, sleep, stress management, and resistance training alone. Fasting simply accelerates the process when used appropriately. The human body is not fragile. It is adaptive. When you stop interfering, when you stop eating constantly, when you stop spiking insulin all day and allow hormonal rhythms to return, the body does what it was designed to do. Choose a fasting window that fits your life. Respect your physiology and let time do the work. Visceral fat did not accumulate overnight and it does not disappear overnight. But once insulin falls, it has nowhere to hide. That is the real answer to how many hours you need to fast. Long enough for your hormones to change and short enough that you can repeat it without stress. If you have stayed with me until this moment, you now understand something most people never do. Fasting is not about suffering, discipline, or proving strength. It is about creating the hormonal conditions that allow your body to heal. Visceral fat did not appear because you lacked willpower. It appeared because insulin stayed high for too long, too often, for too many years. The body responded exactly as it was designed to respond. When energy constantly arrives, insulin remains elevated. When insulin remains elevated, fat is stored. When fat surrounds the organs, inflammation rises. Disease follows quietly. Fasting is simply the act of stepping out of that cycle. The true answer to how many hours should I fast is not a number, it is a state. You fast long enough for insulin to fall, for fat burning to turn on, and for inflammation to quiet, and you stop before stress takes over. You repeat that rhythm calmly. That is how the body rewires itself. That is how visceral fat loses its protection. Short daily fasts train the system. Longer fasts reset the system. Both have their place. Neither should feel like punishment. If you take one thing from today, let it be this. Visceral fat is not a calorie problem, it is a hormonal problem. You cannot starve it away while insulin is high. You unlock it by lowering insulin long enough for fat-burning hormones to take control. That is why someone can eat very little and still not lose belly fat, while another person eats more and becomes leaner. Hormones decide what fuel is used. So choose a fasting pattern that fits your life. Clean up your eating window. Remove snacking. Reduce sugar. Prioritize sleep. Replace electrolytes. Use fasting as a tool, not an obsession. Watch how your hunger changes. Watch how your waist responds. Watch how your energy stabilizes. Those are the real markers of metabolic change. Visceral fat cannot survive in a low insulin environment. It has nowhere to hide. And when it disappears, inflammation falls, organs recover, and the body begins to function the way it was meant to. That is not a trend. That is biology. If you watch this entire lecture, go to the comments right now and tell me the one insight that changed the way you think about fasting. I read those messages. And if you believe this information could help someone you care about, share this video with them. You may be giving them a chance to change the direction of their health. This is Dr. Jamnadas.